Statistics show that heart disease is the #1 cause of death globally, representing nearly 30% of all deaths. There are several procedures that can be performed on heart patients, including surgery and angioplasty. In Malaysia, a new non-surgical cardiac procedure is now being offered at the University of Malaya Medical Center. Is this an alternative treatment to existing procedures? Irin Putri Azmi reports. He suffered 2 heart attacks. And for 64-year-old Masguti Osman, those moments were the most painful experience of his life. Nevertheless, this senior citizen considers himself lucky, as statistics estimated that 4 out of 10 people die immediately after a heart attack. A native of Sabak Bernam, Selangor, Masguti did not suspect that the 2009 incidents had anything to do with his heart, as unlike most heart patients, he did not experience any chest pains. He is grateful to the general public who came to his aid, and their actions saved his life. I was visiting my younger sibling in Perlis. One evening, I wanted to go to the mosque and decided to drive myself there. While driving, I suddenly felt dizzy and thought that I was going to pass out. Immediately, I pulled off the road and turned off the engine. The next thing I remember, there were people crowding around me. I was brought back to my sibling's house. I had difficulty breathing. I couldn't walk very far. After about 5 meters, I was already panting. I had no appetite. Even lying down was uncomfortable. No matter what position I was in, face up, face down, on my side. Coronary bypass surgery is one of the more common treatments for patients with clogged coronary arteries. It is considered the most effective treatment, but as with any other procedures, the surgery has risks. Not all heart patients can undergo a major operation such as this, as there are several factors that can increase the risk. Extracorporeal shockwave myocardial revascularization, or ESMR, is the first non-surgical cardiac treatment to be introduced in Malaysia. It gives new hope to heart patients who are unable to undergo conventional treatment methods, such as coronary bypass surgery and angioplasty. And as we can see, the equipment is relatively compact, and central to this system is the computerized system located at the bottom of the machine. Malaysia is the second country in Southeast Asia to have this German technology. The ESMR has been acquired by the University of Malaya Medical Center, UMMC, at the price of 2.7 million ringgit. This system uses shockwave treatment to treat heart patients. Of the 33,000 heart patients in Malaysia, about 10% do not qualify for either angioplasty or surgery. The ESMR gives these patients hope. Masguti is the first patient to undergo the ESMR procedure in Malaysia. In total, he needs 9 sessions comprising 3 sessions per week. According to the prescribed protocol, the patient must rest for 3 weeks after undergoing 3 sessions of the treatment. Masguti is now back at the hospital for the 4th session. An examination revealed that 3 of Masguti's coronary blood vessels were blocked, which were the cause of his previous heart attacks. However, his narrow blood vessels do not permit him to undergo surgery or angioplasty, a treatment which uses a balloon to open up the blood vessels. Masguti was given only medication to treat his heart problem. and he had to deal with the effects of the lack of blood supply to the heart, such as fatigue and poor appetite. This limited his movements and caused a drastic weight loss. The head of the cardiology unit of the UMMC, Professor Wan Azman Wan Ahmad, was responsible for the acquisition of the ESMR. It all started in 2008 when he visited the University of Essen in Germany, where the system was designed. After successfully acquiring it, the hospital staff received training from the experts in Germany on how to use the machine. According to Professor Wan, since the ESMR was introduced in May this year, many patients have come for the treatment to avoid heart bypass surgery. No, it is not an alternative to surgery, but it is supplementary, complementary for patients who are symptomatic, who still have symptoms after surgery, or patients who cannot undergo surgery owing to an unsuitable condition of blood vessels or for whom the risk of surgery is too high. Dr. Zul Hilmi Yaqub is one of the heart specialists trained to operate the ESMR system. Prior to each session, he and 2 technicians will make careful plans to ensure that treatment is carried out effectively. According to Dr. Zul, the number of heart patients in Malaysia is increasing from year to year. Environmental and lifestyle factors may be among the contributors to the increase. In addition to hereditary factors, health problems such as diabetes, high blood pressure, and excess weight can also increase the risk of heart problems. Dr. Zul added that although the patient, Masguti Othman, is not a smoker, he is categorized as high risk as he suffers from diabetes and high cholesterol levels. Mr. Masguti is one of our patients in the hospital. He was admitted to the cardiac ward. All his blood vessels are very narrow, so the risk of undergoing a heart bypass surgery or angioplasty is high. Since the heart attacks, he has relied only on medication. He said, "That's about all I can do for you now, but God willing, once a machine arrives from Germany, I will let you know. I will treat you using that machine." So I waited maybe a month, but it felt like a year, no? Still I waited. The doctor, Dr. Zul, contacted my son and he said the machine has arrived. Heart patient Masguti Othman is unable to undergo any of the existing heart treatments owing to high risks. He relies only on medication until such time the new cardiac treatment system called the ESMR arrives from Germany. Although the drugs are unable to treat the narrow blood vessels, they are able to reduce the symptoms. Let's watch how the ESMR procedure is carried out. After surviving 2 heart attacks and being unable to undergo conventional cardiac treatment, Masguti will become the first patient to undergo the ESMR procedure. The symptoms he experiences, including poor appetite and reduced energy levels limiting his movements, are owing to insufficient blood supply to the heart. In preparation for the procedure, Masguti had to undergo several crucial examinations. To begin this treatment, he had to first undergo scanning. This is a nuclear medicine scan to find out the area or the region in the heart that is not receiving enough blood. The images from the scan will look like this. And depending on the results of the scan, we will be able to know the area in the patient's heart that we need to treat using this new method, which uses shockwaves. During each session, Masguti will be given 500 shock waves aimed at the problematic area. Today, the shock waves will be directed at the back of his heart. Shock waves are directed at the heart muscle with insufficient blood supply. The treatment will stimulate the growth of new blood vessels in the heart muscle. This treatment is carried out entirely as outpatient care. Patients do not need to fast prior to the treatment. They can walk on their own to the treatment unit, and after the treatment, they can again walk out unaided and go home. Patients are not required to be admitted to the hospital for observation. Once the patient has been given 100 shock waves, the treatment will stop for a while to realign the transmitter. This will be the second treatment, the second zone for today. We will shift our target to an area about 1 centimeter off the area we last targeted. This procedure is very focused. Okay, so 100 shocks have already been given to that area. Now we will shift to another area 1 centimeter away from the last, and we will give another 100 shock waves. Yeah? I don't feel anything. Feels normal. Are you comfortable? I don't feel anything. Maybe slight pressure, like a pillow pressing on me because of the device. The device, yes, the device. So when during the shock waves, you don't feel anything, yeah? When the device goes tock, 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 I feel it slightly in my chest, but it isn't painful. There's no pain. This session, after 500 shock waves, lasted less than an hour. Masguti has to return for the 5th session in 2 days. The shock waves will stimulate the formation of new blood vessels in the heart muscle that has insufficient blood supply. The results are expected to be evident within 1 month of the treatment. New blood vessels are expected to form on the treated area, thereby increasing blood flow. The UMMC is one of the medical centers actively introducing new medical technology. According to its director, Professor Datuk Dr. Ikram Shah Ismail, the UMMC aims to improve its quality of services. The ESMR is one of the methods of treatment that we currently offer. There are several other methods that we plan to introduce, such as the hybrid lab procedure, which allows cardiothoracic surgeons and cardiologists to work together in providing care to patients. We also intend to establish a treatment method called the brain sweep, during which both the neurosurgeons and brain surgeons perform brain surgery using a sophisticated computer. This will allow them to provide a treatment that is appropriate and also safe for the patient. Mr. Masguti has just completed his 4th out of 9 ESMR sessions. He is allowed to go home, but he will need to return to the hospital in 2 days for the next session. Although the treatment program is still ongoing, Mr. Masguti is already feeling the difference. He feels more energetic and his appetite has returned. Isn't that so, Mr. Masguti? The significant changes in Masguti after only a few sessions of ESMR were beyond the expectations of the doctors. They believe that psychological factors also played a part in his recovery. If previously he experienced shortness of breath after walking 5 meters, his condition now has greatly improved. Mas Guti is once again actively moving about in the village and has resumed his interest in gardening. Although he feels much better, his family remains mindful that he does not overexert himself as he has not fully recovered. If previously Mas Guti experienced loss of appetite and lost 13 kilograms in weight, this is no longer the case. Immediately after the first session using the device, I regained my appetite. I got my appetite back. Then after the second and third sessions, thank the Almighty God, I felt a sense of relief and comfort as well. I could lie down comfortably. Several months ago, Mas Guti had no hope of recovery and relied on medication to treat his heart condition. Now, he is grateful that owing to the advancement in medical technology and the expertise of local doctors, he has regained his vitality and quality of life. We have reached the end of the program, and we thank you for joining us. We welcome any comments or suggestions, and you may send them to majalah3.com.my or Facebook/majalah3. Thank you and see you again next week.